Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evon Zoog, also known as The Doc Dudes.
All right, welcome to another edition of The Doc Dudes. I am Garrett Harper, along with
Robert Graper
and
Evon Zoog.
All right, awesome. So today is actually going to be kind of fun. It's a bit casual. The topic today is basically myth busting, right? The naked truth, plastic surgery myths exposed, because we get a ton of questions from patients about procedures, about the ins and outs of plastic surgery, and a lot of times it's just wildly wrong kind of assumptions that people are making. So we figured we each kind of make a little list and go through them. So I'm going to fire some of these off at my opponents here, and I'll take some on as well. But we're going to try and go through like all the different pages we have of all the myths that we have written down. And if we are missing something, then it's because you didn't go to either our website or social media and ask us questions about this kind of stuff. But fear not, if you listen to this podcast and your myth answer question is not answered, then do that. Like, reach out to us, and we'll be able to kind of address it at a future podcast. We'll have like a Mythbusters Part 2, something like that. All right. So I am going to start off with the first myth. I love this one because this happens all the time. I typically get a patient that comes in and has had a breast lift or a breast reduction before, and they say something about the doctor took my nipple off and put it back on. So Evon, Dr. Zoog, the myth is that the nipple during a lift or a reduction is taken off and sewn back on. What is the reality to that?
Reality is we don't like to do that. Sometimes we have to if we have to move that nipple a very long distance.
How many times have you done that in your career?
Since I've been here, I have not done it. Okay. In residency, I did it maybe 2 or 3 times.
Okay, out of like thousands, right?
Correct.
Dr. Graper, how many times have you done a free nipple graft on a patient?
Oh,
I mean, you've been around a lot longer.
10 or 20.
Okay. I've probably done, similar, somewhere around 10 of the thousands of procedures. So not often, but I mean, if somebody has ginormous breasts, because when we're operating for a lift or a reduction, we keep that nipple attached, right?
What's the number you use?
For what?
How far you're going to move the nipple before you'd say keeping its blood supply is not likely, so you're going to do a free nipple graft?
That's a good question. I mean, do you have a number? I don't really have a number.
I tell patients 1% chance of necrosis of the nipple overall in any breast reduction. Yeah. And if that distance is too long where I have to move that nipple or the breasts are too large, then I'm going to recommend doing a free nipple graft.
Yeah, typically.
I've actually got one coming up here in a couple weeks.
I'm 20 centimeters.
You will not move it more than 20 centimeters.
And I probably said it wrong, if the distance between the nipple and the fold, where in the way I do it, it's getting its blood supply from there. If it's more than 20 centimeters, then the blood supply is not reliable.
I could see that.
And why that's important is because if you say it's reliable and it's not, and the nipple dies, then you can't use it as free nipple graft,
right?
Because it's already died.
Right.
So you don't take the chance and you just assume it's not reliable and take the nipple off. And the only problem with a free nipple graft is it doesn't have any of the projection like it used to.
Right.
And it's definitely not going to have any sensation.
Right.
So other than that, it works fine as a placeholder.
Yeah, I also just feel like if you've got to move it a huge distance, you got to keep your pedicle so big that it's hard to reduce these patients down to maybe as small as they would like to go. But it is very rare if you come in and just say, like, I had a lift, I had a mastopexy augmentation, an implant and a lift at one point, and the doctor took my nipple off because I got scars that go around my nipple. That is a huge myth. So fear not. That is not what's happened. All right, second one, Dr. Graper.
Sir.
You're doing my tummy tuck. are you going to make me a new belly button?
Well, number one, I'm just going to do lipo on you. I'm not going to do a tummy
You don't
tuck.
think, well, I probably don't need a
because
tummy
you
tuck,
are
yeah.
trim, mean, lean, fighting machine. No, we're not going to make you a new belly button. We're going to keep the one you got, and we're going to make an incision around it, and all the skin around it is going to move, but the existing belly button is attached to the abdomen by a stalk,
right?
Because that's where you got blood supply when you were an infant, and it stays right there. The skin moves, and then when you've got the skin tacked in, you pop that belly button back up through a new location. It's same place as it was before, but the skin around it has moved.
Right. So when I was little, there was a cartoon called The Snorkels. Like, Evan's way too young. Maybe somebody in here knows that cartoon, but it was a bunch of little like creatures that lived in the sea, and they had a snorkel on top of their head, and that's what it looks like when during a tummy tuck. Like, literally that stalk that you're talking about, it looks like a little snorkel that's coming off of the abdominal wall, and that's the belly button, and it stays there. The same belly button that you've had your whole life, you keep. We bring it through different skin, and then we make it look prettier. So no brand new belly button. Okay, I'll take this one. This is a great one. After having liposuction, you get fat somewhere else. No. What I tell people is think of fat as storage centers all over your body, and think of them as storage garages. Warehouses that can get bigger and smaller, right? So let's say you've got 100 fat cell garages that are all over your body, however they're distributed. Well, if you've got 100 Volkswagen Beetles, you're probably looking pretty good. But if you've got 100, I don't know, Mack trucks, right, or dump trucks, whichever way you want to look at it, and those garages can get bigger, well, then that's not going to be very good. So now imagine that through liposuction, we remove half of your storage centers, right? If you're still parking VW Beetles in the 50 leftover storage garages that you have, you're okay. But if you then bring 100 dump trucks back over and they're going to double up in these garages, then those areas will preferentially grow. So long as your weight is maintained, you are not going to see this. Fat doesn't grow. Matter can't be created nor destroyed. So you do not get fat somewhere else because of the liposuction. You can get fatter in those areas than you otherwise would have if we didn't take away some of your storage centers, but only if you gain a bunch of weight afterwards.
Because those Beetles or those dump trucks have to go somewhere.
That's right.
You're putting on weight because you're eating too much.
That's right.
But as long as you don't eat anything, as long as you don't gain weight, then nothing changes other than the lipo results.
Right. All right, Evan, I can't wait for you to do my breast surgery because I never, ever want to wear a bra again.
Yeah, it makes me cringe when patients tell me that.
Now,
you don't have to wear a bra after breast surgery, but
It's good for business.
Yeah.
exactly. They'll be back in 5 or 10 years and want another lift.
Right.
But I recommend all my patients to wear a bra at all times, especially when they're exercising.
Sure. What about...
It's incredibly important the first 8 weeks
Sure.
as things are healing up.
Sure. And then what about at nighttime, where people always ask me about sleeping in a bra at nighttime?
I don't find it as
Strong
important.
opinion. Yeah, they're anti-gravity.
You're not
at that
standing
point,
up.
Right? That's right. So do not. You're right. Maybe it's job security. Maybe we should tell people, don't wear
Have fun.
bras. Yeah.
Yeah, now if you're a B cup, it probably doesn't matter.
Yeah.
But C and above probably does matter.
Okay. This is a topic where I think all three of us can kind of chime in on. And it's when somebody comes to us and says, my breast implants are making me sick. So breast implant illness. I get patients that ask me who either don't have implants and they're worried about it, they've read about it, or I've got patients who come in and say, I've had my breast implants for 20-something years, and I don't know, I don't feel right and don't feel like it's myself, and we've tried everything else, we've checked everything else, and just can't find anything. So the statement, breast implants make you sick. Dr. Graper, how do you feel about that statement?
Well, I think there are enough things about medicine that I don't understand for me to outlaw it or disregard it entirely. and you'll hear anecdotal reports of somebody that says, I took my implants out and I feel much better.
Right.
But I think there's the placebo effect.
Sure.
And I think there are far more patients who take their implants out and continue to have the exact same problems.
Right.
So I would say if you like your breasts and you have implants, it's unlikely they're making you sick. Very unlikely. But if you just can't get over it and they're scaring you, then take them out, and whether it helps or not.
Sure. Evan, your thoughts?
Yeah. I mean, when I talk to patients about this, about breast implant illness specifically, I think that as an entity, and we were talking about this earlier, there's some people who may have some autoimmune type symptoms from implants.
Sure.
I'm not going to discredit that because I don't know everything.
Right.
We learn things every day in medicine. But when I talk to patients about this, breast implants are the most implanted medical device in patients in the country.
Yeah.
And any medical device, any IV, anything that we use in medicine, essentially, has silicone on it.
Yeah.
So it just doesn't make sense to me. But I'm not going to discredit someone who feels that they need to have their implants out, and I'm happy to do that.
I typically tell patients, I feel like everybody lives on this huge inflammatory spectrum, right? And some people have no allergies, have no autoimmune issues, and just very low. I mean, you can measure things like C-reactive peptides and proteins and things like that to see what somebody's inflammation is like. Those are tangible things that we can look at labs and tell you where you are on this inflammation kind of spectrum. There's no test for breast implant illness. You're right. It's one of these things where do patients feel better after their breast implants are removed? Maybe. Is that anecdotal? Is it placebo effect? Is it a one-off? I mean, what's causing that? What we do know is that there's no statistically significant relationship between breast implants and any illness, right? No illness. It doesn't cause breast cancer. It's when people look between saline devices and gel devices, the body is seeing the outer silicone shell of both devices. So it's not as if there's something that they're dealing with differently if they've got silicone gel devices versus saline devices. Their body's not going to see any different. Now, I have personally twice in my career pulled out saline implants that had crazy mold in them. Have you ever done that?
Not just maybe one time.
Yeah. Evan, you ever seen that?
I haven't.
Rare, right? What I typically joke aside is I'm like, so long as you're not getting saline breast hogs in a hotel in Tijuana, you're probably not going to get this. But, we don't really even use saline implants anymore. So it's not an issue for our patients. But I have seen that twice, was shocked by looking at it. But then again, that mold is confined to inside the device. So again, breast implant illness, constellation of symptoms that you can get from maybe your inflammatory response to them certainly is something that we don't shun you for, but I do want people to use proper terms with it.
If the brain is so powerful that it can make you blind with no anatomical, physiological reasons why you can't see, but you can't see, right, then
it's powerful.
It's powerful. Yeah. And I don't know where that plays into this. There's just a lot we don't know about it. But an otherwise healthy patient, I would exhaust every other thing before I took the implants out.
Yeah.
And if they like their implants. Now, if they hate their implants and are scared of them.
Right. And having issues like encapsulation where you get kind of excess scar tissue around the device, that is not the same as breast implant illness. So let's make sure that we separate those two things. All right, next myth. Plastic surgery makes you look unnatural. Evan, when somebody says something like that, what do you think?
Yeah, a lot of patients, that's can be the first thing they say. I don't want to look natural. I just want to age appropriately for my age. I want to look better. I want to look refreshed. I want to look more fit. When patients are concerned about that, I talk to them about how you really need to trust your surgeon and what their perception of what is attractive breast or tummy.
Or face. Geez, so many people come to us about the California facelift.
Right.
How did this
Right.
celebrity with all the money in the world, why did they look so messed up?
And I think the demographics in LA or Miami or New York are very different than Charlotte.
Sure.
Our patients don't really want that fake, unnatural look, but
Right.
some people do.
Right.
And that's why those populations, those demographics, those cities have more patients who are.
And that's why people fly to LA and Miami to get
Right.
their surgeries, right?
Yeah.
Yeah. Dr. Graper, what do you think about unnaturalness to plastic surgery?
I think there's a lot of it.
Yeah.
I think anything done poorly
Yeah, right.
can be really unnatural looking.
Right.
And some patients, as Evan said, do want unnaturally large lips that look crazy to us, unnaturally large breasts, faces that
Either have
just
crazy
look
lips,
like,
right? Everybody talks about whoever that Real Housewife, Lisa Renner or something or whatever. They always look at celebrities and say, where did it go wrong? I saw something recently where they were talking about Ryan Gosling's face and how it's changed. I'm like, I think that guy's pretty darn good looking. Yeah. But in any event, it's one of these things where it's never like they come in for their first lip injections or their first breast augmentation where they start going crazy looking. You know what I mean? Like if you see the progression of these patients, even on television shows like Botched, they'll show a person and then they'll show, okay, this was after my first breast augmentation 20 years ago. And then I went bigger 19 years ago. And then I went a little bit bigger 18 years. And it's like this, it's like their norm, like their standard for norm gets bumped up and reset, right? It's like once you've had your lips plumped with Juvederm, when a little of it goes away, you're kind of like, you build off of that. And that's how I think some of these people just, because there's just no way they come in looking beautiful and then go out looking cray-cray.
Let me ask you this.
Yeah.
I know our practice's goal is to have people look good and normal and natural and better than they are when they come in. What procedures will you do when a patient wants something that that's not how we would normally do it, and why? And again, which ones wouldn't you do if somebody said?
All right. So my answer is going to sound high and mighty. My answer is 0.
We know what you want.
I will not do anything that I think is going to look dumb just because the patient wants it. And I tell patients all the time
but we're not the breast
consultations, we're not the breast police, but it doesn't mean that we have to agree to do it. And so what I mean when I say I'm not the breast police, which people laugh at when I say that, I'm like, I am going to stick within these implants, and you can get very different looks from these implants, slightly different base widths, but different profiles and those types of things. You can choose between this. But if somebody T90 comes in and says, I want 800 cc implants and they're going to look absolutely crazy, we're all to the point in our career now where we just can say, I'm not your guy. I'm plenty busy, with surgeries. I don't want my name attached to it. I don't want the problems that I know are going to happen. If somebody came to you and said, I want really slanted cat eyes because I identify as a cat person or something like that, how do you feel about that?
My answer in general is if it's easily reversible, then I'm not the eye police or the breast police or, what they think is beautiful. And I usually say, don't tell them anybody who did this. And if it's easily reversible, then I'll do it. But if it's not easily reversible, then I'm just going to say no. And my example to that would be a rhinoplasty when somebody wants a very concave nose. Sure. Fixing that is difficult.
Yeah.
And if they want really large breasts, which a number of patients have over the years, you tell them, okay, at some point you're going to have problems and probably fairly soon. And then you're not only going to have to have more surgery, you may have to have multiple surgeries doing different implants, which all have a cost, and lifts, which have scars. And as long as you understand that, I'm not happy about it, but if we don't do it, somebody down the street will do it.
Yep. I tell them that there's 20 plastic surgeons within a 10-mile radius that'll probably do it. But I really feel like we've done a great job here in particular about building a reputation off of beautiful results that aren't overdone. And it's also, we just don't get that clientele. Evan's right. It's like, it is so rare to have somebody come in with those types of wishes. You know what I mean? So you're right. They must know that we're conservative.
It's a good thing.
Right. All right. Next question. Plastic surgery results last forever, Evan.
Yeah. So they can last a long time. But as we age, we continue to age. You can bring back the clock about 10 years, but it's not uncommon to have if your breasts need a little bit of a lift and another implant as you get older, or you have some extra skin after a tummy tuck. Those are all very, very common revisions or touch-ups that we do. So yeah, things don't last forever.
I mean, nothing lasts forever, right?
Yeah, and
we both know hearts can change.
Hearts can change.
Guns and
except tattoos.
November rain.
Tattoos last forever.
Well, we can laser these bad boys off.
I think facelifts, in a way, last forever, and that they'll always be better than they would have been. And I think eyelids are probably that same way.
Sure.
I'd say noses are that same way. They get older, but they will always look better than they would have looked. So it's sort of a two-tiered answer for that.
Right, and there's little things with the nose, right? With like kind of the droopiness as we age and things like that. But that's a bony cartilaginous structure. Like that thing is, once you fix that, that's it kind of is what it is.
And liposuction, as long as they don't gain weight, it pretty much lasts forever.
True. Now their skin can change with liposuction,
Absolutely.
and we see plenty of people who, are 20 years out from liposuction. And there's no way, I don't care how bad the plastic surgeon was, they thought it was a good result when they did the liposuction, because now the patient just looks like a hailstorm's been thrown against their abdomen. But a lot of times that's because their skin's changed. They probably did look great 20 years ago, and that's why you have to be uber conservative. Another reason why we don't over liposuction somebody is because it may look great on the table. It may look great for 6 months. It may look great for 6 years, but I promise, when scar tissue is a component of your liposuction case, like with abdominal etching and things like that, I strongly feel that people are not going to be happy in 10, 15,
I would think with that.
years.
Alvin, what do you think? Would you?
Yeah, I'm really into the abdominal contouring and treating the trunk and the lower body and doing all that comprehensively. But the things that I don't like to do are the abdominal etching.
Right.
Because I don't think that is going to.
And for people who don't know,
it's not going to last forever.
Right.
And two, it's going to look like.
Well, or does it last forever? Now you're 70 years
Unfortunately, it
old
does.
with this six-pack.
Yeah. So abdominal etching, for people that don't know, like contouring and that kind of stuff, of course, it's beautiful. The abdomen is hills and valleys, and it's important when we're reshaping it to realize that. But abdominal etching is when you, in a grid-like pattern, overzealously liposuction to where the skin is going to no longer have fat underneath it in kind of in lines. And then it sticks back down, scars back down to the muscles, and gives you the look like you had a six-pack.
Waffle iron.
I mean, awful, right? And like, I feel like there's some celebrities, and I don't want to mention them because I'm sure people, there's no way any celebrities listening to this, but I would hate for them to be like I outed them or anything. But there's some that it just, my God, it looks terrible. And I think it's a horrible, horrible idea. So those, unfortunately, do last forever. Yeah, you scar something bad enough, it's going to last.
Things you want to last forever don't, and things you don't want to last forever
That's life, right? Typical life. Okay, so next kind of thing, Graper, this is a great one for you. You can go blind after a blepharoplasty. That's a myth.
I bet you it's true. I think in the world's literature, there have been like 187 cases of blindness, but that includes cases done in Bangladesh and all over strange places in the world. And in America, that number is tiny. And for a board-certified plastic surgeon, it'd be tiny. Yeah. More like you've got more danger of going blind driving to our office than you do of having
looking up at the eclipse.
Surgery.
Yeah, something like that, right? I no one's ever come to this office blind after a blepharoplasty. I can promise you that. So don't let that get in the way of you and youthful-looking eyes, okay? Another one is Botox doesn't work on everyone. That's an unusual one because some people will come in, they'll say Botox doesn't work for me, but Dysport does. And I got to be honest and frank, like I hear you if you say that, or if you say that Dysport works, because those are really close molecularly, right? Dysport and Botox, but different by just a little bit. And so I think what happens is people maybe fatigue on Botox and maybe start to need a little bit more, or it recovers faster than
I have a theory.
3-4 months. Give me your theory.
I think that offices that don't do a lot of Botox, they make it up, and if they don't use it within a couple of weeks, it goes bad.
Right.
And if you make it up inappropriately with a lot of bubbles,
meaning you reconstitute it because it comes in a powder form and you add,
and it denatures with time and with bubbles. So, I mean, we don't have a vial of Botox around here for more than 2 or 3 days.
2 or 3 minutes.
Yeah. So
somebody's using it. If it's open.
Yeah, and So either it's not been prepared properly but too long ago, diluted too much, trying to make it last for the practice, but not the patient.
Either.
Right. Yes.
Right.
But so we do all that.
Oh, I mean, our ladies are amazing.
Agree with that. Okay, so we have gone over a bunch of myths. Not all of them. I get it. If you have other things that you'd like for us to address, drop us a line, website, social media. You can email us any of those things, and we will address it at the Mythbusters, part 2. If you've got questions and they're just, burning a hole in your pocket and you just really want to know some things, then reach out to us, okay? If you've got questions or other topics that you want us to cover, visit www.ghsurgery.com and click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. You can also listen to all of the Doc Dudes episodes on our website, as well as Apple, Spotify, YouTube, or anywhere that you listen to your favorite podcast, which we hope we are. Tell a bunch of people because we're having fun with this. And so the more kind of participation we get from you guys, the longer we'll keep this thing going, which is great. Please follow us on Instagram, Facebook, find out when new episodes drop, and all other information about the practice. I am Garrett Harper signing off on The Naked Truth, Plastic Surgery Myths Exposed. I'll say part 1, because I know we'll probably have a bunch more. Say goodbye to everybody. Dr. Graper.
Goodbye, everybody.
Dr. Zoog.
We'll see you next time.
Awesome. Thanks.